Welcome to Viral and Infectious Disease Training. Washington and Oregon have established specific regulations to protect workers from viral and infectious diseases in the workplace. These rules focus on promoting safe work practices, minimizing exposure risks, and ensuring early detection and response to outbreaks. Washington rules are found at WAC 296, Chapter 800, which requires a safe and healthy work environment. In Oregon, rules are found. This is outlined in OAR Chapter 437, Division 2-1030. At our company, we follow the Viral and Infectious Disease Program to meet these requirements to keep everyone safe. Viral and infectious diseases might be invisible, but their effects can be immediate and long-lasting. Without proper precautions, just one incident can expose many people, both at work and outside of work. After taking this class, you will be able to know the regulation and training requirements that cover viral and infectious disease, including the Washington rules that are found at WAC Chapter 296-800 and the Oregon rules that are found at OAR Chapter 437, Division 2-1030. Understand infectious diseases, identify common pathogens, and recognize their modes of transmission. Identify common biohazards in the workplace, and recognize flu-like symptoms that may indicate exposure. Understand exposure classification system, the associated risk levels for job tasks, and the hepatitis B vaccination program offered to at-risk employees. Recognize early symptoms of illness, apply safe work practices, follow infection control procedures, and properly dispose of contaminated materials to prevent the spread of disease in the workplace. Identify the procedures for post-exposure evaluation and available support following workplace exposure incidents. The correct procedures for handling, cleaning, disinfecting, and disposing of contaminated materials and biohazards. Identify required PPE based on job classification and demonstrate proper use to ensure workplace safety. Identify forms used in the viral and infectious disease program and know where to access them. Diseases spread through direct contact, airborne particles, and contaminated surfaces. Let's examine the facts. Infectious diseases are caused by pathogens like viruses, bacteria, fungi, or parasites that can cause disease. They can spread person to person via contaminated food, water, surfaces, or insect bites. Examples include influenza, tuberculosis, and HIV. Non-infectious diseases are not caused by pathogens and cannot spread between people. They are often linked to genetics, environment, or lifestyle factors. Some examples of non-infectious diseases are cancer, diabetes, heart disease, and asthma. The key difference is that infectious diseases are transmissible and non-infectious diseases are not. What are pathogens? Pathogens are tiny organisms that cause disease. There are 4 main types of pathogens. The first is viruses. Viruses are non-living particles that hijack your cells to reproduce. Examples include influenza or the flu. Second is bacteria. Bacteria are single-celled organisms. Some are helpful, while others can be harmful. Some examples are strep throat and tuberculosis or TB. The third type is fungi. Fungi tends to grow in warm, moist areas and can infect the skin or lungs. Common examples include athlete's foot and ringworm. And the fourth type is parasites. Parasites live on or inside a host and steal nutrients to survive. Examples include malaria and tapeworms. Identifying early signs of viral and infectious diseases is crucial for reducing transmission, protecting coworkers, and maintaining a safe work environment. Common symptoms include fever or chills, a cough, sore throat, runny nose, fatigue, muscle aches, shortness of breath, and nausea, vomiting, or diarrhea. It's essential to closely monitor your health and speak up at the first sign of illness. Doing so helps protect both you and those around you. Influenza spreads quickly through coughs, sneezes, or contaminated surfaces. Norovirus is a highly contagious stomach virus, often spread through contaminated food. RSV is a respiratory virus spread by droplets and contaminated surfaces. Hepatitis B and C are blood-borne viruses that affect the liver. You can protect yourself and others from infection by practicing good hygiene, such as regular hand washing, wearing masks when needed, and staying home when sick. Avoid touching your face after being in public and touching dirty surfaces. Wash up promptly. Always wash your hands or any exposed skin thoroughly with soap and water immediately after removing contaminated PPE or after any potential exposure. Use alternatives. When needed, if soap and water aren't available, use antiseptic wipes or hand sanitizer to clean your hands. Avoid contamination risks. Never eat, drink, smoke, or apply lotion, makeup, or lip balm during tasks where exposure to infectious materials is possible. Also, avoid close contact with people who are sick. Infection control in the workplace involves several key practices to reduce the spread of illness. Regularly clean, frequently touched areas like bathrooms, break rooms, conference rooms, door handles, and railings to limit contamination. Improve building ventilation to help lower exposure to respiratory viruses. Encourage employees to wash their hands frequently with warm, soapy water. Always cover your mouth when coughing or sneezing, and properly discard used tissues in waste baskets. Employees should stay home if they feel ill. Symptoms to watch for include fever, cough, sore throat, runny nose, body aches, headache, chills, and fatigue. During outbreaks, work from home whenever possible and appropriate to reduce workplace transmission. You can protect your home and environment. Keep areas clean by disinfect regularly. You can improve air quality by bringing in fresh outside air. Take flu antiviral drugs if your doctor prescribes them. If you are sick with flu, antiviral drugs can be used to treat your illness. Antiviral drugs are different from antibiotics. They are prescription medicines, pills, liquid, or an inhaled powder, and are not available over the counter. Flu antiviral drugs can make flu illness milder and shorten the time you are sick. They may also prevent serious flu complications. For people at higher risk of serious flu illness, treatment with an antiviral drug can mean the difference between having a milder illness and having a very serious illness that could result in a hospital stay. Studies show that flu antiviral drugs work best for treatment when they are started within 2 days of getting sick, but starting them later can still be helpful, especially if the sick person is at higher risk of severe flu illness or is very sick from flu. If you are at higher risk of severe flu illness and get flu symptoms, call your healthcare provider early so you can be treated with flu antivirals if needed. Follow your doctor's instructions for taking this drug. Flu symptoms include fever, cough, sore throat, runny or stuffy nose, body aches, headache, chills, and fatigue. Some people also may have vomiting and diarrhea. People may be infected with influenza virus and have respiratory symptoms without a fever. Visit CDC's website to find out what to do if you get sick with flu. Learn about some of the similarities and the difference between the flu and the common cold. There are prescription medications called flu antiviral drugs that can be used to treat flu illness. Know the common infectious agents and workplace biohazards. Recognize early flu-like and other symptoms of infectious diseases. Follow safe work practices and infection control steps to prevent the spread of viral diseases. Minimize exposure risks to keep the workplace safe and healthy. Congratulations! You have completed viral and infectious disease training. To get credit for the class, you must take the viral and infectious disease exam on your Toolr app.